everyone, it's Amy with East Valley Moms. Today, I'm really excited to talk about something that is top of mind for so many of us, and that's mental health in children. Today, we are going to be talking with Dr. Prescott from Phoenix Children's Pediatrics, all about anxiety and how to support kids kind of going through or navigating anxiety. So, Dr. Prescott, I'm so grateful for your time today. Why don't you tell us a little bit about yourself?
Yeah, so my name is Jessica Prescott. I am a born and raised Arizonan. Went through high school here, did my medical school in Los Angeles, and then came back here for my pediatric residency training at Phoenix Children's. And I have never left since then. I am currently practicing at the North Gilbert location of Phoenix Children's Pediatrics on Baseline in Gilbert.
And I think it's such a hidden secret that Phoenix Children's has this arm of like well-check, full-service pediatricians for everything. I wish I would have known about this when my son was born because it just has that continuity of care and just that whole, I'm a hospital mom. We have spent way too many nights at Phoenix Children's. And so I wish I would have had that continuity of care early on when we were navigating that. So for anyone out there, this is just such a great resource. One less mental like hurdle for moms to navigate. So we're so grateful for Phoenix Children's Pediatrics. Let's just dive in. So how can we start early teaching proper mental health and coping strategies for kids? I think earlier and earlier, it's one of those things that this generation of parenting, we're just so intent with that. But how do you do that? What's age
yeah.
appropriate?
So, I mean, for a lot of kids, especially even toddler age, a lot of it is knowing how to model to them good emotion regulation behaviors. So basically, not avoiding any of your own feelings and kind of walking them through how you deal with something frustrating, like, oh, this happened to me today, but we're just going to take some deep breaths and we're going to go along with our day. Because a lot of kids kind of, prior, like preschool age and younger, they really can't regulate their own emotions. They depend on, their attachment figure to really co-regulate with them. So being able to hold space for their big feelings and also sometimes your big feelings, I think that goes a long way in terms of teaching kids that all emotions are valid, and there's no necessarily bad emotions. They're all just, they come and they go, and that's part of being human.
Yeah.
So I think, that's one of the things that I would emphasize there.
Okay. That is, my son is going through a big feelings week this week, and I think we are all drained from it.
Yes. Awesome.
Yes. What's the best way, and you can kind of address this at different age levels if that's helpful, to bring up mental health concerns with your pediatrician? I think sometimes it's, I remember even for me that like 6 weeks postpartum, like postpartum depression just survey that you do. Do you offer anything like that for children, or kind of walk us through how to bring up those types of concerns?
Yeah, so I mean, I think that, if you do have a concern about your child's mental health, whether that be anxiety, depression, attention disorders, that type of thing, I think being direct about kind of your concerns and noticing, being able to kind of talk about some of the behaviors that might have changed. So for school age kids, a lot of times anxiety comes out as more of the like body symptoms. So it's
Mm.
maybe it's headaches all the time. It's tummy aches when we have to go to school. It's, always needing to go to the bathroom 6,000 times before we go off to our, team sport lesson.
Yeah.
So a lot of times those will be the things that will get parents and kids in the door.
Okay.
Um, but I think that even just, asking your child about what they're going through and what they're feeling sometimes and doing a little bit of digging there is also worthwhile. But as far as typical screening, we do standard screenings for anxiety disorders, depression, in all of our adolescent patients.
Okay.
And for kids who are younger than that, if there is a concern, we do have age-specific kind of validated questionnaires that
Okay.
will provide the parent and the child if that's, if they're able to fill it out on their own.
Okay.
And that really helps us get a good picture of kind of how things are functioning and what specific things the child or the family might be struggling with.
Okay, that's so helpful. How can parents support a child navigating anxiety, right? So we've kind of identified it. How can a parent best lift them up and support them in helpful ways?
Yeah. So, I mean, I think that, managing a child's anxiety is a whole family process. It's not just the kid goes to therapy for 1 hour a week and that's, 6 months later they're fine. It's really, learning how to kind of encourage them while also pushing them. A lot of anxiety disorders, there's a lot of avoidance with them, especially with like school or certain, social situations,
Yeah,
and really being able to validate their feeling of anxiety while also, pushing them kind of through that to do the things. It's a delicate balance, but I think the main, thing I've seen parents do very successfully is they validate the feeling. Like, I know you're stressed about the math test. I know that if when I was your age, I had math tests and I was scared of it too. But we still have to go to school and take the math test. Let's talk about a couple things we can do in the classroom, before you get started that might help. Like doing some, square breathing where you breathe in for 4, hold for 4, out for 4, hold for 4, etc.
mhm,
Or doing some like muscle clenching and relaxing. So just kind of helping them with those skills that will empower them to do the things without necessarily, feeding into the whole avoidance of it and letting them stay
sure.
home from every math test forever. That kind
Right? It's not going
Yeah.
to help anyone.
Yes.
Yes. And I think we talked about this a little bit, but I would love to hear more of a lot of our audience that have younger kids ask, what's the best way to help pave that road for a healthy mental health coping?
Mhm.
How do we pave that, for like you said, a toddler or even like 2 to 4 year old range? What are your best tips for that age to really pave that way for a healthy mental health family?
Yeah. I mean, I think that the whole process of getting kids to be able to identify what they're feeling,
Mm,
will pay off, in the long term for sure. Because a lot of times, is this anger or is this sadness or is this fear? And it's kind of all just comes out in a crying episode, and who knows what's happening. And we just kind of trying to put out the fire immediately.
yes.
Um, but just, trying to kind of help them parse out how their body feels. Like when I'm angry, I get my fist clench and my face gets all scrunchy, and that means angry, like that kind of thing.
Yes.
Um, and then just kind of, helping them go through different processes to kind of, discharge that emotion or kind of just, work its way through. Like, or this is I'm crying because I'm sad, and what makes me feel better then is snuggling or having a glass of water or something like that. So I think that just, and by parents modeling this themselves, I think a lot of times it's how kids learn. And if your parents are able to kind of show that, you know there's no bad emotions, they just are, and
Mhm.
we don't have to, like, suppress them. I think that that teaches the kids good, emotional regulation skills, as well as just like, they're not afraid to have feelings and they'll know how to cope with them in the future.
Yeah. Yeah. I love that. That is such tangible, realistic advice that is easily applied, right? In small doses, right? Sometimes it's harder. We all have our hard days, but
Yes, for
so
sure.
helpful. Dr. Prescott, remind us of your crossroads. I know you are accepting new patients.
Mhm.
So remind us of your crossroads, so people can
Yes.
kind of
So,
visualize where you're at.
yes. So, we are at the North Gilbert office, which is on the crossroads of Baseline and Gilbert.
Baseline and Gilbert. I drive by you guys on the way to swim school, so I always wave. Well, thank you so much for your time, Dr. Prescott. I really appreciate all the knowledge and insights you shared to help local families really navigate this hot topic.
Yeah, it was my pleasure. Thank you for having me.
Absolutely. Have a great rest.